Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How fast does Latuda work? Latuda, generic name, lurasidone, works in most patients within 6 weeks or sooner at an appropriate dose, although results can vary between patients. Latuda is an atypical antipsychotic approved for patients with schizophrenia or bipolar depression. Some patients may respond as early as 1 to 3 weeks, however, some patients may not respond at all or have side effects that interrupt treatment. It is important that you take your Latuda with food that contains at least 350 calories. Taking Latuda with food will greatly help to increase the absorption of the medicine into your body. Better absorption can increase the effectiveness of Latuda. In randomized, placebo-controlled clinical studies conducted by the manufacturer in patients with either schizophrenia or bipolar depression, significant results of the primary endpoint were seen at 6 weeks in various age groups. Latuda is approved in the US for the treatment of schizophrenia in adults and adolescents, 13 to 17 years, bipolar depression, depressive episode associated with bipolar I disorder, in adults and children, 10 to 17 years as monotherapy, used alone, bipolar depression in adults when used in combination with lithium or valproateThe. The effectiveness of Latuda for longer than 6 weeks has not been evaluated in controlled clinical studies. However, your doctor will periodically reevaluate your response to the long-term use of Latuda if you remain on treatment for longer than 6 weeks. Schizophrenia. Latuda is an oral prescription medicine that is given once a day. It can help keep the symptoms of schizophrenia under control in people 13 years of age or older. Latuda was evaluated in many studies of adults living with schizophrenia and in one study of adolescents 1,317 years of age. These studies looked at how well Latuda works, how safe it is, and how well people tolerated it. In adult patients with schizophrenia, Latuda was shown to be safe and effective. In the trials, patients treated with Latuda had fewer symptoms of schizophrenia than those taking an inactive pill, placebo, at the end of the 6-week studies. Some patients saw significant results as early as the first week. In adolescent patients with schizophrenia, one study showed that Latuda was associated with improvements in symptoms of schizophrenia compared to a placebo, inactive, treatment at the end of 6 weeks. However, some patients did show significant reduction in symptoms as early as the first week. Bipolar depression, depressive episode associated with bipolar I disorder. Latuda has been studied in 6-week studies in adult patients with bipolar depression using it as monotherapy, used alone, or in combination with other agents such as lithium or valproateThe. A significant reduction in adult symptoms was seen at 6 weeks. Some patients had an effect as early as the second week when looking at the monotherapy study, Latuda used alone. A 44% greater reduction in bipolar depressive symptoms was seen at week 6 with Latuda when compared to an inactive treatment. In the combination studies with lithium or valproateThe, a significant reduction in symptoms was seen as early as 3 weeks for some patients. A 27% greater reduction in depressive symptoms was seen with Latuda at week 6 when compared to treatment with lithium or valproateThe treatment plus an inactive treatment. In children and adolescents 10 to 17 years of age with bipolar depression, Latuda was associated with statistically significant and clinically meaningful improvement in bipolar depression symptoms compared to placebo in 6-week studies. Some patients experienced a significant reduction in symptoms by week 2 of the study. A 37% greater reduction in depressive symptoms was seen at week 6 with Latuda when compared to an inactive treatment. To learn more about Latuda dosing in adults and children, visit Latuda Dosing. Related questions: Can you stop taking Latuda immediately? Does Latuda make you sleepy? Is Latuda a mood stabilizer or an antipsychotic? Bottom line. Latuda is an atypical antipsychotic approved in the US for patients with schizophrenia or bipolar depression. In many clinical studies, symptoms were found to have improved by 6 weeks of treatment, but some patients saw earlier results. Patients with schizophrenia receiving Latuda may begin to see improvements in their symptoms as early as the first week of treatment. However, studies evaluated full effects at 6 weeks. In patients with bipolar depression, significant treatment results with Latuda may start as soon as the second or third week of treatment in some patients. These studies also evaluated overall results at 6 weeks. Some patients may not have an adequate response to treatment with Latuda, or may need to stop treatment due to side effects. This is not all the information you need to know about Latuda for safe and effective use. Review the full Latuda prescribing information here, and discuss this information with your doctor or other healthcare provider. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.